So today's topic is dietary fiber. Today's topic is dietary fiber. Chapter 4, carbohydrates part 2, also called as dietary fiber. Okay. Those who have the textbook, please mention the page number in the chat box. If you have the old textbook, it's page number 47. Carbohydrates part 2, dietary fiber. Page number 49 if you have the new textbook. If anyone is joining late, please help them out with the page numbers. So dietary fiber. Do you think it is easy for the human body to digest fiber? I think you are well aware of the term fiber. Okay, that is also a type of carbohydrate. Okay, carbohydrates have different forms: monosaccharides, disaccharides, polysaccharides, resistant starches. Okay, dietary fiber comes under polysaccharides. Polysaccharides means they have big carbon chains. Okay, big carbon chains. And it is not that easy for the human body to digest it, but it has its own benefit because human body cannot break it down that easily. That's a plus point. Okay, you cannot do easy hydrolysis of fiber. Hydrolysis means breaking down the hydrogen ions from the carbon skeleton of the carbon structure of the fiber. Okay, everything that has carbon, everything that is organic has a skeletal structure. Okay, that has carbon, oxygen, hydrogen, other mineral components. Okay, urea, ammonia components will be attached. So breaking down the hydrogen from the skeletal structure is called hydrolysis, and majority of the hydrolysis takes place in the stomach because we have a hydrochloric acid. Okay, and dietary fiber is even resistant to the hydrochloric acid in your stomach. Okay, even your stomach, the presence of that high concentration of acid is also not able to break through and cut down the fiber, okay, into absorbable uh, monosaccharides. Okay, and also certain enzymes in your intestine, pancreatic enzyme. Okay, there are different enzymes in your intestine that help support metabolism, help support digestion. Okay, dietary fiber is also resistant to that, not just hydrochloric acid, but dietary fiber is also resistant to other enzymes in the intestines. Okay, so that is kind of a plus point because your body will try its best to cut it down, and in trying its best to cut it down, body is using up a lot of energy. Okay, a lot of fire is generated in your body to break down the dietary fiber. Is it successful or not successful doesn't matter, but dietary fiber is making your body burn its own calories. Okay, and the other benefits of dietary fiber we will see to it. Okay, so what are dietary fiber? It is also called as roughage or bulk. Okay, another name for dietary fiber is roughage or bulk. Okay, it's plant cell, it's basically plant cell. You get fiber only from plants. Okay, not from any animal sources. So it is plant, it's a part of the plant food that your body cannot digest or absorb. Okay, even if your body is breaking it down into smaller molecules, it is not that small enough for your intestine to absorb. Okay, unlike other food components like fat, protein, or carbohydrates, which your body can break down. Okay, your body can break down carbohydrate into glucose, proteins into amino acids, fats into fatty acids. Okay, so your body can do that, but dietary fiber, you can't break it down further. Okay, So fiber isn't digested by your body. It just passes through your intestine as intact as possible. It may have certain breaks here and there, but more or less it is very intact in its structure. Okay, through your stomach, through your intestine, and even through your large intestine. And as it is, it leaves your body. Okay, if you have noticed, if you have too much of green leafy vegetables, too much of coriander leaves, okay, if you don't chew it properly, okay, or corn, sometimes if you have a corn like makka, maize, okay, corn that you have, okay, it passes through your alimentary canal as it is without much damage. Okay, so that is what dietary fiber is. Okay, it will relatively stay as intact as possible throughout the entire procedure of peristalsis movement. Okay, so the classification of dietary fiber, you have non-starch polysaccharides, resistant oligosaccharides, resistant starch. These are the different types of dietary fibers. Basically, you have soluble fiber and non-soluble fiber. So insoluble fiber, that is the main type. Okay. But apart from that, there are some other types as well. So these names, cellulose, hemicellulose, gum acacia, gum guar, inulin, beta glucan, okay, and under resistant oligosaccharides, fructooligosaccharides, galacto-oligosaccharides, GOS, FOS that you see here, that is GOS stands for galacto-oligosaccharides. FOS stands for fructooligosaccharides. From fruits you will get. Inulin as well, okay. Resistant starch, if you remember the previous class, we have discussed briefly on resistant starch. Okay, they are like, for example, white rice. If you boil it, steam it, you have cooked white rice, you allow it to cool down, or you keep it in the refrigerator, use it the next day. Okay, it has become resistant starch. Potatoes, you have boiled potato, steamed potato, whatever form of potato, you have cooled it down, you let the temperature go down. Okay, that also becomes resistant starch. Okay, so these are the different forms of dietary fibers: non-starch polysaccharides, resistant oligosaccharides, resistant starches. Okay, but the major classification of dietary fiber is soluble dietary fibers and insoluble dietary fiber. Okay, soluble in what? What do you think it should get completely soluble? Okay, from in what mode it should be soluble? What should be the solvent here? Yes, it is water. Okay, it's not your stomach acid, not your enzyme, it's water. The solubility of the dietary fiber depends on water. Okay, so soluble dietary fibers. So this type of fiber, it dissolves in water and it forms a gel. Okay, have you seen what happens if you use isabgol? Have you ever used isabgol, psyllium husk, isabgol? If you put isabgol in water and let it stay for some time, what happens? Or even gond katira. You leave gond katira in water for some time. What it forms? It swells up. It forms a gel. Okay, it forms a gel. So that is soluble. Okay, so it dissolves in water, but it forms a gel-like material, very thick, very viscous. Okay, and any dietary fiber which has this property, when you add it into water and it transforms the water into a gel-like, very thick gel-like consistency, those all fibers come under soluble dietary fibers. Okay. Yeah, it swells and it becomes very bulky. Okay. So what are the benefits of it? If you use soluble dietary fibers, it can lower your blood glucose level, blood cholesterol levels as well. Okay. And majority of the soluble dietary fiber is found in oats, peas, beans, apples, all citrus fruits, carrots, barley, psyllium husk or isabgol. Okay, these all are good sources of soluble dietary fiber, and they are fermentable. Fermentable by whom? Who do you think is taking up the fermentation procedure in your intestine? It's the gut bacteria. Okay, it's this soluble dietary fibers, they create a gel. Okay, they create a gel like substance when they get mixed with water, and this gel moves through your intestine. Okay, and it also is a source of food for the intestinal bacteria, gut microbiome. This is fermentable. Okay, so they are also using parts, the intestinal bacteria is also trying to break it down, use it as their food. Okay, and produce more microbiome, which is necessary for your digestion, which is necessary for your immunity. Okay, so this will undergo fermentation as well in your intestine. Coming to insoluble dietary fiber. So this type of dietary fiber, it promotes the movement of material through your digestive system. Okay. And it does not swell up. Okay. It is insoluble. So it does not swell up like soluble dietary fiber. Even if it is mixed in water, it does not show that property. Okay. It stays intact as possible. Okay. And it helps your gut movement. Something that is not at all changing structurally. It is not mixing up with water. Okay, your intestine will try to push it to try to get rid of it. Small intestine, large intestine, both will try to speed up the peristalsis movement so that this insoluble dietary fiber, which is no use at all, okay, the intestine will try to push it away. Okay, and in pushing it away, what is it doing? It is manipulating the peristalsis movement. Okay, so if you're suffering from constipation or you're not able to empty your bowels on time, okay, insoluble dietary fiber is the solution for you. It increases the stool bulk. Okay, the intestine will not think much about let me absorb the nutrients first and then push it away. The intestine will just try to push it away. It absorbs the nutrients or doesn't matter what, it wants to get your tummy, your gut wants to get rid of this insoluble dietary fiber as soon as possible. Okay, so if you're suffering from constipation, immediately after having some insoluble dietary fiber, you will feel the urge to go to the bathroom. Okay, and also people who struggle with irregular stools at night, if you have some insoluble dietary fiber, early morning you will uh, excrete. Okay, so what are the examples of insoluble dietary fiber? Like whole wheat, wheat bran. Okay, when you are kneading the atta, okay, when you are using sieve to take away the wheat bran, don't use it, don't do that. Okay, don't sieve your atta. Sieve your atta if you want to, if you are not sure there could be some stone or some other material, some other impurity, to take it away. Okay, you can pick it away, but whatever wheat bran you get on that sieve, okay, put it back. Whatever wheat bran you get after sieving the atta, put it back into the atta and knead it with the wheat bran. Okay, you're improving the dietary fiber aspect of your chapatis. Okay, so wheat bran, nuts, beans, vegetables like cauliflower, green beans, potatoes, these all are good sources of insoluble dietary fiber. Okay, and also the amount of soluble and insoluble fiber even within a same food. Okay, potato can have some part of soluble dietary fiber as well and insoluble dietary fiber also. Okay, every kind of food is a mixture of all the other components. Okay, so to have the benefit of both soluble dietary fiber and insoluble dietary fiber, your basic diet should have the combination of both. Okay, both of this will definitely help in losing weight, controlling your blood sugar level, blood cholesterol levels. Okay, people who are suffering with weight issues, diabetes, cardiovascular issues, okay, for all those dietary fiber should be a major aspect. Okay. Is it clear to all so far? Other examples of insoluble dietary fiber is like carrot, fruits with seeds, strawberries, okay, mature root vegetables, roots and tubers you have in vegetables, right? Like tapioca and all, mature root vegetables, not the tender ones, mature ones, okay? Outer covering of seeds. These all are examples of insoluble dietary fiber. So the basic difference between soluble and insoluble dietary fiber, is it clear? The major, what is dietary fiber, in what form they come, what are their main functions in the body? So effects of dietary fiber. It has both physiological and metabolic effects, okay? On nutrients. What happens when you have a meal that is rich in dietary fiber, okay? You have at least 15 to 20 gram of dietary fiber in a meal. Okay, what are the effects on nutrients? So there could be a delay in nutrient absorption, okay, because your intestine is busy trying to break the structure, the cellulose, okay, the cell wall and the structure of dietary fiber. Your intestine enzymes are busy in that, your gut bacteria are busy in that, okay, some way or the other. Nutrient absorption takes a second priority. The first priority is how can we break this thing that is so difficult to get through. Okay. So intestine is worried more about that. So what happens in the nutrient absorption department? It goes down a bit. Okay. There is a delay in absorption, and if there is a delay in absorption, nutrients are not going to wait around in the intestine for a long time. Along with the peristalsis movement, nutrients that were not able to be absorbed, that also moves into the large intestine, and eventually it will leave the body as it is. Okay, so there is a delay in absorption. Okay, and there is a wastage of nutrients as well. Okay. Fiber you have to combine with other food. There is a way how you eat fiber. I'll explain that later. Okay. Then there is a barrier to digestion. Okay. Because of the structure, the structure that dietary fiber has, especially the soluble dietary fiber, when they take up so much of water, there is a lot of nutrients that are getting stuck inside this gel. If you remember soluble, imagine how isabgol is. Okay, you eat you eat isabgol mixed water. Okay, you gulp it down, then you have some food. Obviously in your stomach, this isabgol water and the nutrients and your food is going to combine. Okay, gel like structure will obviously form, including the nutrients and the food. Okay, so it is difficult for the enzymes, intestinal enzymes, to penetrate through the gel-like mesh, get into the nutrients and absorb it. Some majority of the nutrients get stuck inside this gel-like mesh and stay there and get out of the body as it is without proper absorption. So there is a barrier in digestion. Nutrient binding, that is also the same way. Okay, especially absorption of calcium, iron, zinc. Okay, these major minerals. Okay, dietary fiber can affect the absorption of them. This is the undesirable effect of dietary fiber, especially in mineral absorption. Then the water holding capacity, especially of soluble fiber, viscosity or water holding capacity. So you add water into isabgol husk, you see how it becomes, it swells with water. It becomes very viscous. Okay, that is the water holding capacity. So that changes the pH of your intestine as well. Okay, the size of the fiber particle, the degree to which a food is processed. Okay, so these all areas affect the water holding capacity. Okay, for example, wheat bran or any bran that is coarsely ground has higher hydration capacity of finely ground, which means isabgol husk, if you get the organic version of it, okay, which is coarse, which is not fine powder, okay, dietary fiber supplements that are coarse in their structure, okay, that is it is not that finely powdered, okay, that has a better hydration capacity as compared to the finely powdered one. Finely powdered isabgol or finely powdered any form of dietary fiber supplement which is in powder form, that does not have enough water holding capacity. Okay, the one that has a structure, that has a coarse structure, not the powder structure, that can hold water to a better extent as compared to the powdered version of it. And also the delayed gastric emptying when viscous gels are formed, like mesh gels, isabgol, similar like isabgol, what other dietary soluble fibers in your intestine, it will form this gel-like structure. Okay, they don't move through the intestine that quickly. Okay, to push the gel formation forward, okay, your intestine has to maneuver a little bit more as compared to any hard food, okay, any hard dried food, any bolus of food. Okay, if the peristalsis muscles are compressing it, it will automatically push forward. But just imagine there is a gel in between your intestine and your intestinal muscles are compressing it. The gel will get squished, but it is not necessarily, it will not compulsorily move forward. Okay, so there is a delayed gastric emptying, and because of which you don't feel hungry. Okay, when this gel-like structure of dietary fiber is not moving forward, it is staying in your intestine for a long time. Okay, it is not quickly moving away. Okay, what happens? You will not feel hungry. Your brain will still get a signal that something is still there in the intestine. There is something still there in your gut. Okay, until and unless it has moved away, you should not feel hungry. Only when the gut is empty, you will feel hungry. Okay, so that is the reason why there is a delayed gastric emptying and you feel full. Okay, you feel full for a longer time after having a fiber rich food. Then absorption and binding capacity. Lignins, gums, pectins, hemicellulose. Okay, these are different types of soluble dietary fibers. They have the ability to bind to certain enzymes and nutrients in the intestinal tract. Okay, and when they bind themselves to these nutrients, absorption of these nutrients also comes down. Until and unless the binding is cancelled, okay, nutrients are not free, absorption will be affected. And also not some anti-nutrients, okay, some anti-nutrients can also get bound to the dietary fiber, which is more helpful for your body. Okay, if anti-nutrients are not getting absorbed in your body, which are hold which if the dietary fiber is getting stuck onto anti-nutrients like phytates or oxalates, okay, it will not prevent the absorption of other minerals or vitamins. Anti-nutrients will not allow the absorption of regular nutrients. Okay, so in that case, dietary fiber is doing a good job. And also lipids, dietary fiber, the gel like mesh or any other dietary fiber, it gets attached to fat. Okay, it gets attached to fat in a way that it will not allow fat absorption. So that is one way how your cholesterol level goes down. Okay, because dietary fiber prevents fat absorption. You can take isabgol on a daily basis if you know the raw food intake. Okay, if you don't take raw fruits and vegetables on a daily basis, okay, it is difficult for you to keep up Okay, you don't take salads on a daily basis. Okay, if you know your diet is low on dietary fiber, in that cases you can definitely take isabgol on a daily basis. 10 gram of isabgol on a daily basis is completely fine. Okay, so see, one thing is there, can the dietary fiber cherry pick where it should bind itself, where it should not bind itself? Is it on the dietary fiber? Does the soluble dietary fiber has that control? Imagine you are taking a isabgol husk water, you're drinking it. Does the isabgol water has a control? Which nutrient it has to bind, which nutrient it should not bind? Does the dietary fiber has any control over it? It is just playing its part of forming a gel. Okay. Whatever nutrients you had before or just after having this isabgol water, that is your choice. For example, will you take any vitamin supplements along with isabgol water? Will you take any vitamin supplements or any nutritional supplements along with isabgol water? You will not, because there are high chances that the water gel that will be created, it will take away all the supplements as it is. You will not have any benefit of it. So this is how you have to think. Okay, so when do you think is the ideal time to take isabgol or any dietary fiber supplements? At night you can take, or just before your dinner, or just before your lunch? Just before your dinner or just before your lunch? Okay, I will explain that first. I will explain that. Okay, how it works, I will explain that. Also, increased fecal bile acid secretion. Okay, when any dietary fiber is too hard for the intestine to digest, your liver will start producing more bile to cut it down. Okay, so more bile acid means your lipids, your fats, okay, that will be metabolized. More bile acids will make sure that more fat is getting metabolized, and also it lowers your serum cholesterol level. There are shift in bile acid pool, okay, because of which the cholesterol level comes down. Because cholesterol is used in making more and more bile. Okay, when the liver is producing too much of bile to cut down the dietary fiber, to produce more bile, cholesterol will be used. Okay, so cholesterol is not getting stuck in your blood vessels. Even if you have some cholesterol issues, cholesterol will be taken up by your liver to convert that into bile, to produce more bile. Okay, so if you keep your dietary fiber healthy, if you keep using healthy amount of dietary fiber regularly in your diet, what it will do, the cholesterol that you already have in your body, it will be used up by your own body to produce more bile. Okay, so cholesterol, everyone should have cholesterol. Cholesterol is required in your body to make hormones, to make bile, to make other enzymes. Okay, but when does the problem start? When the cholesterol is not used for making hormone, you already have enough hormone, you already have enough bile and enzyme, and you are eating more fatty food, more cholesterol laden food. Okay, and this cholesterol, which cannot be further used, gets deposited in your body. Okay, that's when problem arises. But when your own body is taking up this cholesterol, deposited cholesterol, for its own use, okay, to keep up with the bile production. Okay, so what's happening is that your own body is taking care of the cholesterol, just because of dietary fiber supplement. Okay, Then you have degradability and fermentability. Fermentable fibers, these are soluble fibers like pectins, gums, oatmeal, wheat bran, psyllium. Okay, these can be fermentable. The bacteria that is present in your colon, okay, your small intestine, they they try to eat onto this dietary fiber, and they produce hydrogen, carbon dioxide, methane gases. Okay, and these gases will be excreted from your body as flatus. Okay, or it is also expired by your lungs. Okay, so your body has its way to remove the gas, either through farting or through the expiration by lungs. Carbon dioxide is released out. Okay, usually uh, the presence of this soluble dietary fiber like inulin and all, okay, they are fermented by the bacteria, and they act as a prebiotic as well. These act as a food for the bacteria as well, and it helps in the growth of lactobacilli, bifidobacteria. These are good healthy bacteria. They have major role in your body. Okay, a lot of chronic diseases in human beings can be prevented, okay, if you have a healthy gut microbiome. On top of that, the more variety of bacteria you have in your intestine, that is more better. And how do you think you can add more variety of bacteria? How do you think you can increase the variety of gut bacteria in your intestine? Having variety of food. Having variety of food. Okay, if you want to increase the variety of gut bacteria, you have to have variety in your food. Okay, you also have to make sure that you travel. Okay, this is a lifestyle approach. You travel, you try new cuisines. Okay, you don't stick to one cuisine. If you're a South Indian, try Western Indian cuisine, East Indian cuisine, North Indian cuisine, Middle Indian cuisine once in a while. Okay, once a week or so, or twice a month or so. Try other cuisines. Okay, sometimes try Korean food, international cuisines. You have to, nowadays everyone has access to different cuisines. Okay, incorporate different cuisines, or at least elements of different cuisines into your diet. Okay, for example, fermented food like dosas, idlis, they're very good for your health. Okay, does it imply that only South Indians should have it? Will idli or dosa not work for North Indians? It will work in the similar way. It will provide the same health benefits. Okay, take up healthy habits from your neighboring countries or neighboring states. Okay, internationally, see what other countries are doing to improve their gut. Okay, so you have to add more variety in your food. Okay, add as much as variety of vegetables, as much as variety of fruits. Okay, start from that, then go into cuisines. Okay, so the more variety of food that you eat, it leads to more variety of gut bacteria, because every food, every different type of fruits you eat, they have their own bacteria. Okay, gut friendly bacteria. Different fruits have different bacteria in them. Okay, if you are having apple, okay, except for the seed, if you know the seed area of the apple, usually you throw it away. Remove the seeds and eat that entire area. Exactly, just remove whatever 3 4 seeds are there in the apple. Just remove that, and the stem of it, and the entire apple you should eat, because gut friendly bacteria is present in the center of apple. Near the seeds, gut friendly bacteria are present. So the more variety of raw fruits and especially raw fruits and vegetables when you add, the more variety of gut friendly bacteria you are introducing in your immunity, in your intestine. Okay, so having a variety of bacteria is very important, because different type of disease conditions There is a series in Netflix. I forgot the name of it. If you just type gut, gut gut in Netflix, you will find a web series on it. If I remember the name of it, I will put it down in the chat box. Okay, but as a nutritionist, as an aspiring nutritionist or dietitian, you all should watch that series. Okay, you will get a lot of insights on nutrition. Okay, diet. Hack Your Health, I guess. The series name is Hack Your Health. So this is the most recent area of advanced medical researches, okay, where gut microbiome, how it is responsible for various diseases that you suffer from. Okay. So fermentability, the more fermentable food that you eat, like pickled vegetables, they are already fermented. You are just introducing it. Okay. Even if you are having Yakult or probiotic food, probiotic milk like Yakult and all, okay, fermented milk, more than half of the bacteria, millions of bacteria is present in that Yakult milk. Okay. But when you drink that, more than half of it gets destroyed by your hydrochloric acid, and whatever remains enters your intestine. Okay, remember that. Okay, whatever you're eating, whatever probiotic or prebiotic you're eating, remember it has to pass through your stomach and then reach the intestine. And in the stomach, there is hydrochloric acid. So whatever probiotics you are putting in, it has to surpass that hydrochloric acid, reach the intestine, and then reproduce, again reproduce. Okay, mingle with the pre-existing microbiome. That is also very important. Okay, whatever your gut microbiome also protects you from future infections. Okay, if you're eating something that is not that great, it has some like food poisoning and all. Okay, why food poisoning happens? Why food poisoning happens? Because your gut microbiome was not vigilant enough or strong enough to attack those toxic bacteria that entered your gut. Okay, fermented batter, once cooked, the bacteria will die definitely. But what is the use of idli or dosa? Fermentation in idli and dosa batter makes it easier for your intestine to continue the digestion. Okay. Fermented batter of idli dosa means what? Half of the digestion work is done. Half of the digestion work is done by the bacteria. Remaining half is the task of your intestine. So it is gut friendly. Your intestine does not have to spike your blood glucose level to get into the nutrients. That is the technique of fermenting the batter using dosa and idli. Okay, half of the digestion is done. Majority of the digestion is done by the bacteria during the fermentation process. Remaining half, your intestine can tackle without causing any bloating, nausea, vomiting. Okay, any indigestion. Okay, you rarely it happens that a person had bloating or nausea or vomiting after having idli or dosa. Okay, they are very gut friendly food. Very gut friendly food. Reason is fermentation. Okay. Is it clear to all? So prevention of diseases. How does dietary fiber helps in preventing diseases? First is your cardiovascular diseases. In points, they have given a lot of points under degradability and fermentability. You can just go through it. Okay. It also, when it comes to degradability and fermentability, when you have more gut, when you have more gut bacteria, do you think the gut bacteria can infiltrate your intestine and cause you disease? Because they are capable of it. Gut bacteria are capable of it. They can enter the intestine and they can cause you harm. but there is something that prevents it. There is a layer of mucus layer between the intestinal cells and the bacteria. This mucus layer, okay, it prevents the bacteria to stay in the intestinal lumen only. You play there. This is your playground. You are only bacteria are only allowed to play here. You're not supposed to enter inside the cells, because that's when infection can happen. So there is a mucus layer. They're like bodyguards. Mucus layer. They protect your intestinal wall. Okay. And what happens is that if you are not having dietary fiber, if you don't have enough dietary fiber, okay, your bacteria will try to eat this mucus because they are hungry. They have to survive. Something or the other they want. Okay. So what happens? This bacteria will start eating your bodyguard. Okay. And automatically, when the mucus lining gets thinner and thinner, the bacteria, gut bacteria itself can infiltrate your intestine and give you diseases, give you inflammation, infection. Okay. So when you have good amount of dietary fiber in your diet, it makes sure that you have enough mucus lining. There is enough mucus cells, more than enough mucus cells that are proliferating. More mucus cells are produced and more mucus is produced so that your intestine stays safe, free from bacterial infection, from its own bacterial infection. Okay. Fermentation of carbohydrates gives energy to the gut bacteria. It acidifies. Fermented food, the pH is lower, so definitely it keeps the intestine acidic, and if the intestine is acidic, it helps in the absorption of vitamin C, calcium, iron. Especially iron requires an acidic environment. Okay. So fermentation in your intestine keeps the intestine acidic in nature, pH acidic in nature. Okay. It helps in the absorption of minerals like iron, okay, calcium, zinc, vitamin C. Non-fermentable fibers, the one like the insoluble fibers, you will not expect any energy from them. Okay. The only work that they do, mainly the work that they do is they increase the fecal volume. Okay. They push majority of the food that you have eaten, undigested, partially digested, okay, completely digested, everything will be formed in a complete bulk, and the intestine will try to push it out of your system as soon as possible, because the intestine cannot deal with something that it cannot break. So it wants to push it away as soon as possible out of the system. So while pushing it away, it is creating a lot of bulk. Digested one, undigested one, intestine doesn't care. Intestine just wants it out of the way. Okay. So it increases the fecal bulk and you excrete a lot. Okay. And that also leads in weight loss, because a lot of fat is undigested, okay, unabsorbed, and it leaves your body. So it leads to fat weight loss as well. Okay. Is it clear to all so far? So prevention of diseases, cardiovascular disease, coronary heart disease. If you have cholesterol, if anyone in your family has cholesterol, high fiber diet is the solution to reduce cholesterol. Okay. Especially advise them to eat specific food like apples, guava, that is amruk, okay, that can lower the cholesterol level. Gorgum, okay, that is also excreted from seeds, that also has hypocholesteric effect. All forms of legumes, make sure on a daily basis at least one legume you're having in your meal. Okay. Monday rajma, Tuesday moong, okay, Thursday some soybean. So at least 6 days a week legume should be there. Okay. It's a great source of protein and a really great source of uh, dietary fiber. Okay. Kabuli chana, black chana, okay, rajma, kidney beans, moong dal, okay, white beans. These all are legumes. Peas. even the dry peas. If it is not the pea season, you have the dry peas option. Okay, that's also really good source of fiber, dietary fiber. So yeah, to prevent malnutrition, we have an upper limit. We'll discuss that, okay, of dietary fiber. So legumes, vegetables, and fruits should be in big portions for a cholesterol patient's diet. Okay, psyllium husk, you can give them isabgol. Oats, barley, fenugreek seeds. They have hypocholesteremic effect. They also have hypoglycemic effect. They can reduce the glucose as well as the cholesterol. Both can be reduced with fenugreek seeds water. Okay, or try to add more methi powder in your regular food. Okay, methi seeds, methi powder. Okay, methi leaves. Adding methi powder is the most easiest option. Next is diabetes mellitus, dietary fiber as well as complex carbohydrate, a combination of both. It benefits all types of diabetes, type 1, type 2, gestational. Okay, every type of diabetics will benefit from a complex carbohydrate rich diet and a dietary fiber rich diet. Here also certain fruits, you have to be very specific about the fruits that you give to diabetes patients. Okay, we have discussed that. Low glycemic index food, like low glycemic load fruits, that can be given. Vegetables and grains, legumes. Fenugreek seeds is compulsory for diabetic patients. Have I mentioned about fenu flakes in any previous classes? Fenu flakes, you can search it in Amazon. Okay, have anyone tried it? Did anyone ordered it, and have you ever tried it? Fenu flakes, for one person, if you order one bottle, it should work for an entire month. Okay, especially if there is somebody who is diabetic in your family. Okay, it's very good to invest in fenu flakes. Okay. Then constipation, next disease condition is diverticula or constipation. Diverticula, it is like outpouching of your intestine, large intestine. Okay, small outpouches are formed in the large intestine, and the fecal mass, feces, stool that passes through your intestine can get stuck here, and it can lead to infection, inflammation. That is diverticula. Okay, so to prevent diverticula, to prevent constipation, fiber-rich diet is good. People who suffer from inflammatory bowel disease, IBS, Crohn's disease, colitis, okay, in these conditions as well, dietary fiber will improve the symptoms. Colon cancers, several mechanisms have shown that dietary fiber can prevent colon cancers that runs in the family. Then definitely weight control, because when you are having a fiber rich diet, even if you have a little, even if you have the bulk of the diet is small, but if it is fiber rich, you will feel satiated. Okay, you will not feel hungry soon after. Okay, for example, if you have white rice and if you have brown rice, okay, obviously you will feel hungry after having white rice. Okay, brown rice or brown rice that has that bran intact, okay, that is fiber, that will keep you full for a longer time. And fiber also increases, if you're having any fiber rich food, you have to chew it for a long time. Okay, When you chew a lot into when you're eating food, when you are consciously chewing a lot, automatically your satiety comes down. Okay, you feel full with just small amount of food. So coming to RDA, okay, this is important to prevent malnutrition, as somebody had asked earlier, that fiber poses a threat to nutrient absorption if it is taken too much. So what is the upper limit? It is 60 gram, not more than 60 gram of fiber per day for anyone. The gender, age doesn't matter. Don't take more than 60 gram of fiber on a daily basis, because according to the international standards are 30 gram for men, okay, and around 25 gram for women, okay. And if your activity levels are moderate or heavy, the fiber intake will also be high. But for a sedentary person, sedentary man, 30 gram, for a sedentary woman, 25 gram, okay. And for anyone, for whatever is your uh, weight, whatever is your lifestyle, don't take more than 60 gram of fiber per day, okay. And sources: per gram, per 100 gram of food, how much fiber it has, soluble as well as insoluble. It's given on in the textbook. A table is given, okay. Majority of the food that we use in Indian cuisine, okay, all vegetables, majority of the vegetables, certain fruits, okay, cereals, pulses, they have mentioned 100 gram of each of this. How much insoluble and soluble dietary fiber is there per 100 gram? Okay, it's mentioned in a table. You can put the page number of the table in the chat box. Those who have the old textbook, it's page number 60. Chiku or sapota, which in some areas they call it sapota, chiku fruit. Okay, carrots, they are rich in insoluble fibers. Fenugreek seeds, they have soluble as well as insoluble fiber. Both is there. Refined food and processed food, they don't have any fiber, dietary fiber, it's negligible. Assignment I'm not giving right now.